in knowledge of this early treatment. And so we worked to fill that gap, one by increasing knowledge. And while hospital systems like Larry's at Lee Health and here in Tampa at Tampa General had been embracing monoclonal antibodies really since they were given emergency use authorization at the end of 2020, many physicians did not know about it, and it was not something that was being utilized to the fullest extent. So we saw that gap. We saw that folks were testing positive. We saw the admissions escalating, and we wanted to provide help for people. So we started talking more about the notion that COVID is a treatable illness, that there is an ability to get early treatment, and if you do it early in the form of monoclonal antibodies, the track record has been very, very good. And so we worked in August to expand that message, but also to expand access. And so we stood up over 25 different sites throughout the state of Florida, including one right here in Hillsborough County. We did one in Pinellas, Manatee, Pasco, all up and down the state. Many of those, or all of those, could see over 300 patients a day. We were doing 4 It worked for me, and that really, I think, did more than anything to raise the awareness. And so we've seen other sites, but including the hospitals. And so they had a dramatic reduction in the amount of Regeneron, and even they're reducing it even further for this upcoming week. So to put it in perspective, the most recent shipment that we're scheduled to receive for the entire state of Florida is a little less than 18,000 doses of Regeneron. Our state sites just a few weeks ago were doing well over 30,000 doses just in our sites. That doesn't even include any of the hospitals. So not only have they cut dramatically from what we were using, they're now saying this is also what the hospitals get as well. So we're in a situation where we have to now send to the providers that need it. So statewide in Florida, where we had 45,000 doses a week just a few weeks ago, we're now less than 18,000 doses of Regeneron, so we have to provide to Lee Health, we have to provide to Tampa General, and we have to provide for our sites. And that's not a good situation to be in. That is not a 50% increase. That's a dramatic reduction. And I would hate to see somebody who really could benefit from this treatment not be able to have access to it when we know that the track record has been very, very positive, not just in the clinical data and real-world data, and of course Florida being the most recent example where you see thousands and thousands of people being kept out of the hospital. So cutting the medication to Florida and other states is wrong. It's not consistent with the promise that was made just a couple weeks ago, and we are going to continue to fight against that. At the same time, I, as governor, have a responsibility to do everything I can to provide help for folks who need it. And so, yes, we have much lower hospital numbers, much lower cases. Everything like that is much better than it was a month ago. But at the same time, COVID doesn't go away. At the same time, we do see people who are vaccinated who've tested positive much more frequently than we had anticipated just 6 months ago. And so we know there's going to be a continuing need to make this early treatment available for folks. And so I'm in some respects sad that I have to announce, but I am happy that we're not just sitting on our rump. We're making things happen. So the state of Florida has been able to acquire an additional 3,000 doses of the monoclonal antibody sotrovimab, which is manufactured by GlaxoSmithKline. It got emergency use approval just a few months ago. The clinical data that they had was really, really strong. In fact, it was even stronger than Regeneron, and we know Regeneron's been very, very effective in real world. So we're going to be able to use that sotrovimab to bridge some of the gaps that are going to be developing as a result of the Biden administration dramatically cutting medications to the state of Florida. Now, the sotrovimab is an IV only, whereas the Regeneron is approved not just for IV, but also subcutaneous injections. The folks you'll see here who will talk about what they were able to get at our state-supported sites, they all got injections. Injections are easier. It's 4 shots, 2 in the belly, 1 in each arm. They do observe you, just like they would observe when we did vaccines. You want to see if there's a reaction. So they do observe for an hour, but you can go in and get it quicker. The IV takes a little bit longer to administer, and so that will, even though we have these doses, we're going to use them, you're not going to be able to do 320, most likely, doses at a given site. Nevertheless, we're happy to be able to have acquired this. We are going to put it to good use, and we're going to continue with our state sites. At the same time, we may have to be making decisions soon about how many of the sites can remain open. We're making decisions about how many doses each hospital is going to get, and these are not decisions that we should be having to make. Clearly, these are not decisions that would need to be made if they had increased the allotments by 50% instead of dramatically cutting it like they did. But sotrovimab is coming to the state of Florida. We are going to be deploying it, and particularly for our high-risk population, we want them to be able to, as soon as they test positive or as soon as they develop symptoms, to be able to come in and get that early treatment. I think the results have been very good so far, and I anticipate, given how strong the clinical data has been with sotrovimab, I anticipate we're going to continue to see very positive results going forward. Now, I do want to say, as much as it's been good, we've really helped change the narrative nationally by making this available. Many people are interested in this early treatment throughout the country. This has been something that's been being done in Florida really for the whole year. And Larry down at Lee Health has been doing, as I mentioned, I did an event a month or two ago at Tampa General. They were doing the clinic, they were doing some of the experimental treatments even before it got the emergency use. So Florida hospital systems, many of them have embraced this and have had a lot of success with it. We've now really, I think, increased the understanding of it, the public awareness of it, and of course, we've made it easy access. And so, but I want Larry to be able to come up and be able to talk about how they've used it at Lee Health, and I think how they're going to continue to want to be able to draw down supply of these very effective early treatments. So Larry, the floor is yours.
Thank you, Governor DeSantis. The monoclonal antibody program has really been a game changer here in the state of Florida. We know, based on the studies, that if you give monoclonal antibodies within the first few days of diagnosis, you can reduce the hospitalization rate by 70%. This is incredible. And if you look at just at our region in Lee County, the state has given over 8,000 doses. You can imagine how many people have been saved hospitalization. And it's reflected in what we're seeing. At the peak of this Delta surge, we were admitting 80 to 100 patients a day with COVID. Now we're admitting in the mid-20s. And our census has gone from 652 down to 251. So it's made an incredible difference. It's getting people better. It's getting people better quicker. It's keeping them out of the hospital. And I think you'll hear some testimonials today from patients who received this antibody, and they'll tell you that it was easy, it was well run, minimal to no side effects, and they felt better quickly. So I want to thank the governor and his whole team for doing this. It's made all the difference in the world here in Florida.
Okay, well, we're happy to have some folks here who've been able to benefit from the monoclonal antibody treatments. So the first is Luke Castoria. He had heard about Regeneron. I mean, the first time most people heard about Regeneron was when President Trump got it, and that was not even on the market yet at the time. It was experimental. Lou tested positive recently, and he was able to utilize it. So he's going to come up and tell his story.
I'm going to read from a prepared statement. So I'm Lou Castoria. I'm 58 years old, and I live in Land O'Lakes, Florida. I'm a senior software developer for a large financial firm based in the state of Florida. Before I get started, I'd like to thank the governor and his staff for having me out to tell my story and making monoclonal antibody treatment available widely in the state of Florida. I started feeling ill August 29th. Through the day, I felt worse and worse. Sunday evening, I assumed that I had COVID-19. At that point, I decided to get the monoclonal antibody treatment. I went to the Florida Health Department's website, clicked on the link, scheduled my appointment for Tuesday. Monday morning, I went to the doctor and was tested for COVID-19, and as expected, I was tested positive. So then on Tuesday, for my appointment, I went there, and at this point, I was feeling much worse. I had 101 fever, rapid heart rate, and very tired. I then got the treatment, and by Tuesday evening, I was feeling much better. My fever had dropped, and by Wednesday, I had no fever anymore, and by Thursday, I was able to return to work. Now, I work remotely, so I wasn't going to get anybody infected, and today, I'm back to 100% with no lingering issues. Thank you.
Thank you. Okay, we have Betsy Palmer-Bigler. So she's a former math teacher and science teacher from Pasco County. She has her husband receive Regeneron, and then they're being in the same household. She received it before she even tested positive prophylactically, so she's going to come tell that story.
Thank you so much for having me here. I'm very happy and delighted to share what happened in our household with the COVID. My husband was unknowingly exposed by a coworker and started with some flu-like symptoms. We had bought home rapid test and tested him, and he was positive. And right away, his employer told him about the Hudson and Pasco facility, Mike Fasano Health Department, and he went and received the injections. I myself was scheduled for about 10 days out for a surgery. Also, I have high-risk factors, including high blood pressure and age, and went right after him. So we drove separately, but were able to get right in. Everything ran very smooth, fast, easy, experienced, knowledgeable people there, and we received the injections. And I was able to get the surgery because I never contracted the COVID after getting the monoclonal antibody injections. I was very concerned about him. He's a 30-year smoker, also diabetic, so I was more concerned for him than really myself, especially with respiratory complications that might happen. However, that never happened. So he had a fever for several days and tired for a few days too, but was able to kind of bounce back. Also in our household is my 80-year-old father-in-law with congestive heart failure and diabetes. And after a few days, unfortunately, he did test positive, and he went the same day and received the injections and only had about a day and a half of a 99-degree fever. So our household was really interesting in who needed it and why, but we all received them and all came through just fine. And That's the reason I wrote the governor's office with a lot of gratitude in my heart, because I sincerely feel that it saved, probably one or all three of our lives, being able to have those. So anyway, thank you. Thanks.
Okay, Jeff Randall is a guitarist. He's in a band, lives in the area, and so he's going to talk about his experience, but also I think your mother as well did it. Is that true? Yep, go ahead.
Okay, well, this is all new to me, so thank you all for being here, and thank you for letting me speak. My personal story is that my wife and I started getting sick, and we started getting sick with COVID. We took the home test, tested positive. My name is Jeff Randall. I'm 64 years old. I've suffered 3 heart attacks. So having COVID-19 is not what you want to hear when you suffered 3 heart attacks and you've already got a breathing problem. That's not what I wanted. We proceeded to go to Hudson, Florida, to the Pisano Center, which you aptly provided everything we needed, and they were fantastic up there at Pisano Center. We go in, fill out a questionnaire. They lead us to another area where we get our shots, lead us to another area where they want to make sure we're not going to have any reactions to the treatment that we received. After that, I started to go home. Everything's fine. And within about 2 to 3 hours before that, my body ached. I always thought COVID maybe was not real, but it's real. It hurts your body, your bones, your muscles, your headaches, your fever, the nausea, the chills. It makes you want to cry, a grown man cry. After I'd had the shots, the treatments of the Regeneron, within about 2 to 3 hours, I actually started feeling better. And I mean better. My wife will attest to that because I'm a big crybaby when I hurt. I didn't hurt anymore, and it felt great. Within a day or two, I was ready to start eating again. My appetite came back, and everything's fine. The day I got my Regeneron